In the emergency department, we often depend on law enforcement for patient and staff safety, but law enforcement presence can also compromise patient care. So emergency medicine is unique. We have law enforcement present. Is this going to advance on its own? Yes. We have law enforcement present, whether it's for a trauma activation, if they're bringing in a patient for medical clearance, bringing in psychiatric patients, and while they can be critical, they can also lead to issues in terms of delays and interference in patient care, issues around patient privacy and HIPAA. And in order to prevent incidents like this one in Salt Lake City between a nurse and a law enforcement officer, we need to pay better attention to how law enforcement in our departments affects patient care and interactions. So I work at Highland Hospital in Oakland, and we're the county hospital and safety net hospital for the county. We take care of all of the incarcerated individuals in Alameda County. And in our emergency department, on a typical Friday or Saturday night, we could have more than a dozen law enforcement officers from different jurisdictions across the county in our department. And so we wanted to look around and see, how does this ubiquitous law enforcement presence affect the delivery of patient care? And we created this online survey, which anyone can do. It's just a Google form that residents, attendings, nurses, and techs have used to log concerning and confusing interactions with law enforcement. And ever since we started doing this, people started to pay more attention, and they started to log more and more interactions. And some key themes have come up, and I want to share with you a few specific examples that we've identified in our own department. So the key themes that our providers have brought to us are issues around law enforcement causing delays or interference in patient care, law enforcement bringing up confusing issues around privacy and HIPAA, and then the ways in which law enforcement presence can negatively impact that sacred patient-provider relationship. So when it comes to delays and interference, this typically comes up in the setting of a trauma activation, which is already busy and sometimes crowded. And sometimes when law enforcement are trying to do their jobs to prosecute a crime, they actually get in the way of an active resuscitation, and in some cases, grind a resuscitation to a halt. Here's an example from a provider that didn't know whether or not they could actually ask law enforcement to step aside. And in fact, they refused. So another example that our providers have brought to us is HIPAA. As we all know, HIPAA applies to patients who aren't in custody, but it also applies to patients who are in custody. And so while there's exceptions for active criminal investigations, those exceptions are often much narrower than most providers realize. And we've identified numerous HIPAA violations due to law enforcement presence. In this instance, a resident was asked if they could provide the police officer with a copy of the patient's chart for a patient who is not in custody. In another instance, they describe a nurse explaining to the officer all of the tests the patient had done, her medical problems, and all of her injuries, and then offered to provide a copy of the chart. She wasn't trying to do anything wrong, she was just trying to be helpful, and so this points out that we need more training. Finally, our providers have pointed out that when law enforcement is present, this can affect patient-provider rapport. Patients might think that law enforcement and healthcare providers are aligned, and they might even alter their care-seeking behavior because of it. They also might not realize that they're entitled to a private history. In this case, this patient didn't come to Highland Hospital because he had a warrant out for his arrest, and he thought that if he came to the ED, that the police would pick him up for his outstanding warrant. So now what do you do? So when we collected all of this information, we went to our hospital legal counsel and we learned more, and we developed a set of policies to better train our providers into how to care for these patients when law enforcement's around. But you don't have to go that far. You can simply ask law enforcement to step out of the room when you're interacting with a patient so that they can have a private history and exam. And 99% of the time they do. You can learn more about HIPAA and make sure that you aren't violating it just because there happens to be a police officer involved. And if you want to go that next step, you can do what we did, and you can work with your hospital legal counsel. We've created a comprehensive hospital policy, and these policies go over really sticky issues from how to handle patient privacy, how to handle patient property, especially if it's illegal things like drugs, how to encourage providers to provide patients with privacy and a private exam, and making sure that law enforcement doesn't get in the way of an active medical stabilization. So I encourage you guys to look around, identify areas of inconsistency or confusion amongst providers, and take steps to improve care for your patients while maintaining those important relationships with law enforcement. Thanks.
Kyle? Judges?
Thank you. Great presentation. I think that one area that you briefly mentioned that we depend upon law enforcement for our own security is much more obvious and clear in small rural hospitals, because typically I work in a large city, and a large urban hospital has its own security force. Typically they themselves actually do have police authority in certain cases. But in a little hospital in rural America, which is most emergency medicine, you do not have security. Your only recourse when you need some muscle is the local police department. And you don't want to be on the wrong side when you do have that blood sugar patient. It is a really, really, really tricky line. So I guess I would just say future area for research is how to try to apply the same sensitivity that you guys have shown in situations in which the lines are not as clear as they are when the hospital security are clearly employed by the hospital and the sheriffs are employed by the sheriff. Thank you.